Welcome to Raaonline. Today's topic is medical management of osteoporosis. So in this presentation, we'll see that osteoporosis is characterized by a loss of bone density and mass, causing an increased risk of fractures. We'll see that the decrease in estrogen levels after the start of menopause causes a sustained drop in bone density in most women. The most common osteoporosis related fracture occur in the hip, the spine and the wrist, and these types of fractures can be extremely debilitating and lead to many complications. The consequences of osteoporosis are significant in terms of its overall cost to the healthcare system. And new treatment agents has been recently approved by the FDA, which include the abaloparatide and the romosozumab, and they offer additional therapy options for patients with a high risk fracture risk or for whom the previous therapy has failed. So coming to the diagnostic criteria of osteoporosis. Diagnosis of osteoporosis is made by the low T-score as measured by a dual X-ray absorptiometry scan. Why we do DEXA and not CT? Because CT has got radiation exposure and DEXA has got less radiation exposure. And a T-score and Z-score are measured. A T-score compares the patient's bone mineral density to an average bone mineral density in a healthy young adult. So T-score is done for a lumbar spinal, radius of forearm or femoral neck T-score or a hip T-score which is less than 2.5 is considered diagnostic. Fragility fractures is another diagnostic criteria other than DEXA scan. So if the patient has suffered any fracture that occurred from a minimal trauma or by simple activities of daily life, then also she is osteoporotic. And finally, there is another tool that is called as FRAX tool, that is called as fracture risk assessment tool, and this scoring may be used to confirm the diagnosis and the need for pharmacotherapy for osteoporotic women. This is the FRAX tool, which is the country based model. So I am showing a UK model, and this is the 3.2 version of the FRAX tool. So patient needs to enter her age, date of birth, gender, weight, height, previous fracture, previous fractured hip, current smoking status, use of glucocorticoids which increase the risk of fractures, history of rheumatoid arthritis. Patient also needs to enter whether she has secondary osteoporosis, whether she takes alcohol 3 or more units per day, and what is her DEXA value of the femur neck. And after selecting the mineral density of as assessed by the DEXA scan, we can calculate the risk status for fracture as per FRAX model. Now this FRAX algorithm calculates a 10-year probability of a major osteoporotic fracture in each patient. The guidelines have been given by the American Association of Clinical Endocrinology, that is AACE, and by the American College of Endocrinology, that is ACE, for the treatment of postmenopausal osteoporosis. So who needs therapy? Anybody with a T-score between -1 and -2.5 and a history of fragility fracture needs therapy. Anybody with who has osteopenia with a FRAX 10-year probability of more than 3% for a hip fracture or more than 20% for other major osteoporotic fracture, or any person who has a T-score at any location of less than 2.5. Now, if there is a history of a low trauma fracture on simple activity, then also the patient is diagnosed to have osteoporosis and is started on therapy. The ACE and ACE guidelines recommend that lifestyle modifications and non-pharmacological therapy should be started for all patients with osteoporosis. Serum calcium and serum vitamin D lab values should be evaluated prior to initiating pharmacotherapy for osteoporosis. 25 hydroxy vitamin D levels should be maintained at 30 to 50 nanogram per ml, and patients who are older than 50 years should have a target intake of 1000 to 2000 international units of vitamin D3 daily. Calcium intake should be evaluated, and calcium should be taken at 1200 milligrams per day for women older than 50 years. Dietary intake of vitamin D3 and calcium is preferred over calcium and vitamin D3 supplementation. However, if dietary intake is not feasible, supplemental use with the help of tablets should be recommended.